Now let's talk about some tumors and cancers that affect the kidney. The first one is renal cell carcinoma, the most common primary renal malignancy in adults. It typically happens in men who are 50 to 70 years old, and obesity and smoking increase the risk. So 50 to 70 years old, and obesity and smoking are risk factors. And it's often called clear cell carcinoma because you can see these cells here, they are clear because these cells are filled with lipids and carbohydrates, and when the cells are prepared for light microscopy, that lipid and carbohydrate gets removed and it leaves these clear polygonal cells. So from which cells in the kidney do these tumor cells originate? It's the proximal tubule cells. It could be any tubule cells, but usually it's the proximal tubule cells. Now, symptoms of renal cell carcinoma include hematuria, a palpable flank mass that you can feel on the patient, polycythemia due to which hormone being produced in excess quantity. Erythropoietin gets produced, and these patients have very high hematocrits. Flank pain, fever, and weight loss. The tumor invades the renal vein and then the inferior vena cava, and this can obstruct blood flow, sometimes causing lower extremity edema. The tumor cells spread hematogenously in the blood and metastasize to lung and bone. It's associated in von Hippel-Lindau syndrome with a gene deletion on chromosome 3. So patients with a mutation on chromosome 3 can have von Hippel-Lindau syndrome, which can lead to high risk of renal cell carcinoma. Now, treatment for renal cell carcinoma is going to involve, first of all, resection of the tumor and immunotherapy with antibodies. Prognosis is generally poor because a tumor is usually discovered late due to its position deep within the body, and it's usually resistant to chemotherapy and radiation. Next is renal oncocytoma, which is a benign epithelial cell tumor. On histology, you see large eosinophilic cells like you see here. All these cells, very large eosinophilic cells. And they have abundant mitochondria and no perinuclear clearing. Symptoms of renal oncocytoma include painless hematuria, flank pain, abdominal mass, and treatment is removal of the kidney, nephrectomy. The next malignancy is Wilms tumor, which is the most common renal malignancy in children. For this reason, we would expect the embryonic cell types to be present in the tumor, such as embryonic glomerular structures, and that is in fact what we see on light microscopy. It's typically detected in early childhood as a palpable flank mass, sometimes detected by the mother when she's washing the child, and it generally has a good prognosis. Now, this tends to be a high-yield fact for the exam because of the association between Wilms tumor and two known tumor suppressor genes, WT1 and WT2, which stand for Wilms tumor 1 and Wilms tumor 2. Now, if you think back to genetics, you'll remember that list of tumor suppressor genes. You remember which chromosome WT1 and WT2 are found on. The answer is chromosome 11. And additionally, Wilms tumor can be a part of a syndrome known as Beckwith-Wiedemann syndrome, or a complex of findings known as the Wagger complex, which involves Wilms tumor, aniridia, genitourinary malformation, and mental retardation. Transitional cell carcinoma is the most common tumor of the urinary tract system. Although transitional cell carcinoma can occur anywhere in the urinary collecting system, it's much more common in the bladder or the ureters. Bladder or ureters. It often presents with painless hematuria. And remember, there's going to be no cast because this is after the renal tubules. One important thing to remember is that it's very strongly associated with smoking and also with the chemotherapy drug cyclophosphamide, which causes hemorrhagic cystitis. It's also associated with some more unusual chemicals like phenacetin, which is an old analgesic that has gone out of use, and aniline dyes, which are used as precursors to many industrial chemicals. Now let's look at squamous cell carcinoma of the bladder. And it all starts with chronic irritation of the bladder. And things that can irritate the bladder include things like schistosoma hematobium infection, which is more common in the Middle East. Chronic cystitis and chronic nephrolithiasis also irritate the bladder wall. And smoking is carcinogenic in general, and it increases the risk of squamous cell carcinoma in the bladder. So that chronic irritation leads to squamous metaplasia, and then as the cells gain more mutations, they become dysplastic, and eventually, if they get enough mutations, they become squamous cell carcinoma. And this cancer usually presents as painless hematuria. And obviously, they're not going to be in the form of casts, so red blood cells in the urine won't be in casts, and therefore you know that the red blood cells are not coming from the kidney. And so if you see a patient with painless hematuria, a good tip-off that they might have squamous cell carcinoma of the bladder. Now let's try a flash quiz. A 58-year-old former smoker presents to your office with weight loss and hematuria. When you listen to his heart, you notice a prominent systolic flow murmur that is new to his exam. What is the likely diagnosis? The answer is renal cell carcinoma. The weight loss and hematuria in a former smoker, hematuria and weight loss, plus former smoker, should tip you off big time to a renal system malignancy. Renal system malignancy. Now it could be in the kidney or in the collecting system at this point, but the prominent systolic flow murmur in the patient indicates that the patient has a high hematocrit and very viscous blood. And this all ties together to suggest renal cell carcinoma that is producing high levels of erythropoietin. So you had to tie a lot of things together there, but it all fits with renal cell carcinoma.